another leaf-like one called foliate, but it's not very common.
So what's this function again?
Just surface area, sensory, grooming if we were a different animal. So that's showing all of these tiny little black triangles here. Those have been on here, it's these. So they're by far the most numerous. So in number it would be filiform, then fungiform, and then the least numerous would be the circumvallate.
What's the foliate?
Foliate doesn't have sensory, they're a shape, yeah, they're not very common. I don't even talk about them.
Filiform was the most.
But they were very common.
Yes.
I wonder if the female animal
Circumvallate is the least.
that got the amniotic.
Oh, really?
I don't know.
Oh, I don't know. It's been a while since I've done this comparative.
You said the most numerous was filiform?
Uh-huh. You can just look at that far right picture on the bottom, scanning electron micrograph. And there's one fungiform here, and then all of these are the filiform around it.
Question?
Yes.
What would make one of the bumpy thingies turn white and fall off?
Lack of blood supply or blockage, I don't know.
Oh, okay.
Burn, destroyed by surface. I don't know why just one.
What happens
I
when?
think you lose a patch of.
Chicken tank carrots that look stiff and
Sometimes you get one that pops out and puts you in.
It turns white and you keep playing with it because it hurts?
But then you can just bite it off.
So I'm going to erase the picture over there in just a moment when you're ready.
I just let it fall off.
And we're going to look at teeth.
No taste but for spicy?
That's kind of the meaty taste and the spicy kind of overlap with that umami. Oh, the canker sores? How do they get rid of it? Well, it's thought to be a viral infection, a herpes type virus. Herpes zoster. And it just uses the immune system. It's a viral attack. You can't really take antibiotics for it. All right. So may I erase the board?
Start on the left side,
Okay.
please.
That's this side?
Not the nerves, though.
Board side or your side? Actually, I'll leave those nerves up there if that's what you're still trying to
Yeah.
I'm just pushing on.
write down. We don't have a model of the tooth that has quite the complete information that's on here. We have a model of a tooth that looks like that, but what we're missing is the bone structure and gum line, and that's really necessary for determining the three different regions. So I can see the crown and the root, but I don't know exactly where the neck is. The neck region of the tooth is defined by that area covered by the gum line. So that part of the tooth is still covered with enamel, but covered by the gum line. So if your gum tissue is receding, that part of the tooth that's the neck is going to vary. So here we have the bone, and this would be the alveolar processes of the maxilla and mandible that the roots are inserted in. Anybody remember what we call the joint between the root of the tooth and the bone? A gumposis. All right, so one of the onomatopoeia type words sound like, it's not quite as good as truncate, but if you're gumming your food, you don't have any teeth. I always think of that when I hear the word gumposis. All right, is it a fibrous, cartilaginous, or synovial joint?
Fibrous.
Fibrous. Is it freely movable, or immovable, or slightly movable?
Immovable. Immovable.
Immovable. So it would be, unless your teeth are falling out,
Yeah.
but it's considered to be a synarthrosis, or synarthrotic joint.
I've actually literally had a doctor tell me that they're not supposed to move. And then he moved one of my teeth and said, oh, it's supposed to be like that. So which is it?
Okay.
It was after an accident, I broke one.
Oh, and it got.
And I broke another one, yeah, it was a motorcycle accident.
Well, we have the periodontal ligament, so that tells you where the fibers are located, because ligaments are formed of collagen fibers. Okay? So here would be the gingiva. So I'm going to draw I'm not going to draw the entire bone, but I'll draw just enough of the bone to put gum line on it. So this would be our gum and alveolar process. I had kind of a narrow tooth, so let me draw the tooth first and then draw the gum line in here.
I'm getting tired of it.
Okay. Okay, so looking at just region, this part that has enamel associated with it, shown here, above the gum line would be the crown, and I haven't drawn it very high. This part that has enamel with it associated with gingiva would be the neck. And this part of the tooth that extends into the alveolar process and has cementum is going to be the root. Okay, so those are the regions of the tooth. And so the covering we will have enamel. Which is considered to be the hardest substance in the body, but it's not replaced if it gets worn away or eaten away by acids and bacterial waste.
Or soda.
Yes. The covering of the root is known as cementum. It would be the yellow surface on that model that I brought out of the tooth. And this would be what would interact with the periodontal ligament to be attached to the bone. So neither cementum nor enamel is considered to be a living tissue. It doesn't have cells, they don't have cell tissue within them. The tissue that does is have cells and replaces is the dentin. Okay, and those cells are known as odontoblasts. So within the dentin we have tooth spaces. Within each tooth we have a root canal, within each root we have a root canal, which is how blood supply and nerves get up into the tooth. And then that expands in the crown and the neck region to form the pulp cavity.
I don't get why they need to have nerves in tooth.
To let you know, why we don't just have dead teeth. So that's the pulp cavity. This would be the root canal. And the opening into the root canal is known as the apical foramen. Now, it's down at the bottom of the tooth, but it's where it comes to a point or apex. Kind of like the apex of the heart. It's kind of in a weird position. All right, and everything else in here is considered to be dentin. So if you have a wearing away of your enamel, typically they're not going to place a filling unless that has worn away and exposed the dentin. If that cavity or dental caries has deepened so it reaches the pulp cavity, then typically if you're having dental work done, it would result in a root canal. If there's any abscess or infection, they would pack it with antibiotics, and then you would have a root canal done in which they kill the nerve, pack it with the maintenance material, and then seal that with a crown. Now, why go through all that expense? Why not just pull the tooth?
Well, then you don't have a tooth there.
And this is what's done. I mean, they will pull the tooth if you've got say a bunch of local dentists and physicians are going on a trip to Guatemala or over to Thailand or somewhere, and they're providing medical and dental care. They're not going to be doing root canals and making crowns. Okay, they don't have, it's expensive. They don't have a dental laboratory, so they'll probably just pull the tooth. But here's what results if you have your teeth come out or pulled, and you don't have the ability to create adequate pressure while you're chewing. So dentures help prevent this. Remember when osteoporosis, and you want to do weight-bearing exercises as you get older to balance the activity of the osteoclasts against the osteoblasts. So with the teeth gone, and you don't have dentures, when you chew, you're really gumming, and you're not creating sufficient pressure on the jawline to allow for the odontoblast, to allow for the osteoblast to replace the matrix removed by the osteoclast. And so here the alveolar processes, and even lower alveolar processes, where you can actually see some of them right here, have been completely removed by the osteoclast. So you would, dental implants are even better. They're not worried about a fit. That's where they actually remove the tooth and then place a screw into the bone tissue, and then an artificial tooth is capped over that.
That's if the bone works, you hold it.
Right. You can't do it on this. You have to do it in this before it gets to that level. That can be expensive. I know my brother-in-law is a dentist. He did a full mouth dental implant for a client that would have cost the client $30,000. He did one for a woman who paid him in cash, $30,000. This individual, was not able to afford that, and so they did a barter system. The guy was a stonemason and did a wonderful job, but was having, he didn't have a good public appearance because his teeth were rotting and not being taken, were not adequate. And so they kind of did a barter system. So in my sister's backyard now, she has a huge stone fireplace that's probably about 8 feet wide and has seating on both sides, and about 15 feet high. On the opposite side, very similar to it, is a pizza oven that matches the appearance of the stone fireplace, and then a built-in barbecue, and then a stone patio that ties the two together. And so I don't know how the taxes got handled for either of those, but when you do a barter system, but they each got what they needed, out of that activity. So let's just look briefly at dentition. I'm married to a guy doesn't work as a CPA, but we always want to hear about that kind of stuff. So anyway. On the left, we have what's known as deciduous or primary pattern, and on the right is the adult. The difference for each corner of the mouth, each quadrant of the mouth, is 3 teeth. So we have 20 teeth, total top and bottom in the child. And the adult dentition has 12 additional teeth for 32. So I'm not going to diagram it on the board, but if you're ready, I'll erase the diagram of the tooth and write out the names of the teeth. Okay? And we're almost done. I have a salivary gland to do, and that'll be it.
Oh my gosh.
Oh, good, I'm shaking.
So for the primary dentition, we always start in the midline. We have the two cutting teeth, which are the central and lateral incisors, which is what incise means, or excise is to cut. So that would be these here. Just lateral to that, so we're going medial to lateral, anterior to posterior. We have the cuspid or canine, and you may call them canine, or dog tooth. So some individuals, like my husband, these are actually quite a bit longer. They don't quite look like fangs. He's not a vampire. But they're a little bit longer than the rest of his teeth, which is why they get that name. And then we have the first molar. And these are, the cuspids are tearing teeth.
So you said they could be that or canine?
Pardon?
Which ones are the canines?
The
The
Cuspid.
cuspids.
Oh. And some people, they keep growing.
Pardon?
For the, some people.
Yeah, they'll shape them.
They'll keep growing.
Oh, they'll keep growing.
I mean, for my sister's boyfriend.
So cuspid, that's when they get a little bit long in the tooth, they say, when somebody's older.
Are those the vamp teeth?
Yes.
And then we have the grinding teeth, which
Oh my
are the
gosh,
first
so blah.
and second molars. So then, once those fall out and the permanent teeth come back in, the same ones will reappear. Not the same tooth, but the same appearing tooth. It will be a second tooth. And so in the, let me change that to purple, show it better. So we get these 5 plus an additional 3. So between the cuspid and first molar, we get first and second bicuspid, or a more modern term is premolar. I don't care which ones you use. And then the third molar. Third molar is commonly known as the wisdom tooth. Now, pulling out teeth is not a difficult thing to do. Some people do it to themselves, and they're not loose. I had 4 teeth pulled for braces. I was under general anesthetic, but I didn't wake up, with a sore mouth and have to stay home for a couple of days. The third molar is a little bit more difficult because if it has to be taken out, it's because there's insufficient room in the lower upper jaw, and it usually is sideways, okay? And it's pushing against the roots of the first and second molar, and usually the bone has to be cut, and so it's a bit more damaging and inflammatory to the tissues to go through that particular surgery. So we have the model of the tooth that I have up front, and then we have this model that kind of shows you the different ages in the